Hi everyone. If you're office manager or dental office owner managing a patient with Open Dental, um, this is a tool that will change your life for the better that I'm going to present to you. And I'm looking at this Open Dental interface with a test patient selected, and you can click on the Open Dental Inside button, and it will land you to a web page that fully integrates Open Dental, allow to see um, all patients' key information about this patient in terms of their balance, their insurance benefit, their treatment schedule, planned and scheduled treatment, as well as patient recall, com log, insurance benefit breakdown for different category. So it's one button of click lends you a central page of one page about the patient summary. So that's how you go from Open Dental to the page. However, the web page allows you to see a lot more. In Operation Insight is that allow you to see hygiene and a doctor appointment in terms of hygiene hours, doctor hours, as well as doctor total production in the next 2-3 weeks, so that you can schedule your future appointment accordingly. And there's all other statistics so that you can see the um, in the future month or so where the doctor's schedule break down into primary or fill-ins and so forth, so that you can schedule wisely. And there's a lot of other business inside or production inside for new patient counts and first time visit to production, and the patient that we don't see anymore for more than a year, and so on so forth. And this allow us to track all our effort in terms of insurance estimate is done correctly or not. Insurance is payment is collected promptly. Patient payment is collected promptly. All the patient will have a future appointment or a reason that they are not making an appointment, and this tracks the percentage of the patient that does make future appointments. So all of that is live, connect to the dental database. Should we need to schedule for a more production or patient, we have tabulated the list of patient for different category. For instance, the new patient that we see in the last 90 days that we did a comp exam, but we haven't scheduled hygiene appointment because our hygienist is so busy. So we have a list so that you can walk through them. If they don't make appointment, for whatever reason, we can com log in Open Dental, it will show up here. So we know that how many times we reach out to them. And there are a recall list for each major category: perio, clear correct, and so on and so forth. For each one of them, we can recall them. And for instance, we did a crown bridge, and for each one of them that we did a recall effort that we will document in Open Dental and show up here. And for front desk, there's a lot of office or clinic specific rules or policies. And when staff implement them, people make mistakes. And so this page with one page sort of create a punch list of all the errors it caught automatically for you. For instance, we're using a child profile for patient older than 14, active patient with inactive patient with future appointments that hasn't been canceled, obsoleted code that is scheduled in the coming 2 weeks. So all of them needs to be cleaned up as on a daily basis. So there's a lot of office specific policies that is automatically tracked. For instance, that we needed to have a PA for build up and extraction unless we know that we don't need we already taken the PAs. And there's also exams that is due but not scheduled. That patient has an upcoming appointments that we can put a exam associated to the appointment. There's many other things that we track. For instance, treatment plan, consent paper signature, and also routing slip scan check. All of that will allow us to make sure the front desk workers QC'd. We also quality check the lab. For instance, the labs that we are associated to an appointment, yet we haven't received it from the lab, so we need to reach out to the lab in a prompt manner so that we have the case ready when the appointment is on the appointment day. And also we haven't received a lab case for more than 30 days are tracked. So we also help the doctor to track their clinical notes needs to be all written before the claim can be sent, and so on and so forth. We also manage the tasks within the Open Dental that we can assign tasks to individual staff, and it's all tracked here, and it helps us to monitor individual staff that how many ongoing tasks are there for them. And we also track the claims that has like the procedures is performed yet, but more than 60 days or within the 60 days, but hasn't been attached to a claim sent, but not a claim hasn't been sent for appointment completed in the last 60 days or so, and so on and so forth. We talk about the patient insight that with one page allow you to see all the patient's information, key information. We also help to reconcile the account, like how much cash you received with what you has been logged in Open Dental versus Care Credit versus Open Dental with credit card or point of sales information with Open Dental, and so on and so forth. We also allow you to see the production insight, allow you to see an overview of code by code. For instance, this crown in the past, where the production is coming, total production, as well as where the code production is coming from a different carrier, and you can add more code to it. For instance, you can add additional codes as you go. You can also look into different category. For instance, how many oral surgery that we have done in and the production wise, and where they come from, and monthly summary of production year over year. So this is a quick overview of many functions that are offered by Open Dental Insight. And I do a live demo of this patient that, for instance, I made a mistake of this patient, the test patient, that he is more than 14 years old, and I'm making an appointment with a child pro-fee code. So for instance, I'm making a child pro-fee appointment, and I put it here on the April 12th on a Saturday, and we can go back to uh, the front desk operational control, and sure enough, it shows up here that on April 12th, there's a patient that more than 20 years old, yet with child pro-fee. So I come here and correct this appointment from child pro-fee to adult pro-fee, and I save it in Open Dental, and I go back to the web page and refresh it, and sure enough, it's gone. So it takes a second to update in the database, and now you see that within a few seconds, the information is gone. For instance, if the patient is inactive and does have a future appointment that we need to cancel, so I'm gonna just come here and make this patient inactive. And you can see that from the patient, and I say inactivate him. And as soon as I inactivate this patient and refresh the web page, it will show up as this patient has a future appointment, but the patient is inactivated. So I will either delete the appointment or make this patient active again. So in this case, I will delete this appointment. So I'll delete this appointment, and I'll go back to this and refresh the browser. It takes a couple seconds. So it's gone. So this is a quick demo with overview of the Open Dental Insight. Thank you for your time.